And not only is Hollywood shining a light on diabetes, but so are we right here on The 10 Show. Today we have an entire show dedicated to diabetes awareness, management, and prevention.
Well, when it comes to diabetes management, eating right is certainly important. So Lori Enriquez is here from Independence Blue Cross, a registered dietitian with tips on making some very easy choices that'll make a very big difference. Lori, good to see you.
Nice to see you
Welcome
too.
to The 10 Show.
Thanks for having me.
So anyone can be on a diabetic-friendly diet and do just fine. In fact, probably in fact better than they're doing right now.
True, true. Anyone with diabetes really can eat almost any food. All foods can fit. It's more of a matter of how much, how often, and making the better choices on most days.
Now, people love easy snacks, and a trail mix or a dried fruit certainly is an easy one. And it sounds healthy. Is that a good idea?
Well, it's a good point. If you can see in these servings, you don't get too much for the same amount of carbohydrates.
Oh, so these are equal servings here?
These are equal servings.
What do you need to know when it comes to drinks, beverages?
This is an area that a lot of people actually forget to think about, and so you can easily drink a lot of calories and also a lot of added sugars.
Hey, join me and other Philadelphians this fall as we hit the streets for the Step Out Walk to fight diabetes. The walk, which is set for October 3rd, is presented by Independence Blue Cross. It's the American Diabetes Association's most important fundraising event of the year. It's not too late to register. Go to diabetes.org/stepout or call 1-888-DIABETES. Joining me now is Lito Huertas. Did I pronounce that correctly?
Yes, you did.
Okay, not bad.
Not bad.
From IBC Fitness, meaning you are actually in the gym working with people every day to help them with their health.
Correct. We do work with the associates of the IBC company to get them healthier every day.
Fabulous. Let's talk about the benefits of exercise. You've actually brought someone who's going to be exercising for you, David Reynolds, who's standing here as well. So the benefits of exercise, let's talk about those first.
Yeah, well, the benefits of exercise, especially for this population, is that, exercise is going to burn calories, which is going to help you reduce your weight. And for diabetics, it's very important to maintain a healthy weight to avoid other complications that may occur in the future.
Okay, so now we have David here, who is going to show us the exercises. Thanks so much for being here.
Thank you. Yes, but before we exercise, if you live an inactive lifestyle or have diabetes or other conditions, you want to make sure you get a physician clearance before you start any workout program.
All right, so make sure to talk to your doctor. Now, David, you've talked to your doctor, right?
I do.
Okay.
Very often.
All right, so the first thing that you say is squats are important.
Yeah. You want to work your large muscle groups. This is going to help improve your circulation in your body because it makes the heart pump a little harder to get those muscle groups because they're larger in your body. So Dave's going to demonstrate a regular squat. Now, if you're home watching TV or at your office, use a chair. You can sit down in a chair and then stand back up as a repetitive motion if you have balance issues and things like that. You can take it a little further where Dave can take a couple of steps forward, good balance, and make it a little harder for yourself without support. And at the same time, later on, as you get more advanced, you can add resistance like weights and dumbbells and things like that.
Okay, let's make sure it's not a rolling chair.
Right.
Exactly.
That's all I'm saying. Make sure you want to keep a chair that's heavy. It's going to stay there for you.
Yeah, make sure the chair is stable and there's no wheels on the chair. Definitely not.
So whether you've been newly diagnosed with diabetes or you've had it for years, there are some things that you can do to help manage the condition effectively. Joining us now is Dr. Ron Brooks, Medical Director of Independence Blue Cross. Thanks so much for being here. Diabetes management is so important. I think a lot of people are afraid of actually getting a diabetes diagnosis, but you can manage the disease.
Absolutely. Diabetes is a very serious disease, but doing the right things can lead to the ability to control your diabetes and live a normal life.
A normal life, a healthy life, normal life. I've interviewed a lot of people since we started doing this campaign, and they're managing their diabetes well. One thing that you say you have to do is know your numbers. And when we're talking numbers, we're talking about your A1C goal, and that should be below 7. Tell me what A1C is.
Well, A1C is a test that measures how well your blood sugar has been under control for the past 3 months.
All right, and so you're talking to people that have diabetes, right? We're not talking about pre-diabetes. Okay, correct. A1C. Then blood pressure goal, also important. LDL cholesterol, also important to know those numbers.
Yes, one of the major reasons that people with diabetes wind up with complications is that they wind up with things like heart attacks, amputations, kidney disease, and these are all things that are related to their blood vessels. And we know that the blood pressure does damage, high blood pressure does damage to blood vessels, and it makes the heart work harder. So it's very important for people with diabetes to keep their blood pressure under control.
You got a lot to think about.
Yeah, and actually we shoot for even lower numbers in patients with diabetes than we do in the general population. So The blood pressure that we're shooting for is 130 over 80 or less.
And the LDL cholesterol goal is less than 100. And understand your disease and join a support group. That's also important.
Yes, and one of the biggest myths is that you can have a little bit of sugar or just mild diabetes. Diabetes is diabetes, and it's important to learn about the disease. Go to the ADA website at diabetes.org. Insurance companies like www.ibx.com has a lot of information about diabetes, so you can learn what is really important to control diabetes and to prevent it if you're at risk for it.
Right. You need to be a partner with your medical professional.
Absolutely.
All right. Thank you so much, Dr.
Thank you.
Ron. Thank you. I'm going to toss things over to you, Bill.
Lori, let me introduce you to Marion Hay, who is a wellness manager for Independence Blue Cross. It's important to manage diabetes when you're at work, too. Marion, thanks for being here.
Thank you for having me.
If you have diabetes, you have it 24/7. Employers now, more than ever, are sensitive to people that have diabetes and other
Correct.
conditions as well. Is it important to work with and talk to your employer about how they can help you?
Yes, absolutely. Talk to your employer about implementing a worksite wellness program. At Independence Blue Cross, we work with and we partner with commercial customers and assist them with implementing worksite health promotion programs and offering a variety of programs that really focus on a healthy diet, getting exercise, quitting smoking, and stress management, certainly, which are all part of a healthy lifestyle. Be sure to check with your employer to see what types of free or reimbursement programs that your health plan might offer, and take advantage of those, whether it's a reimbursement for a smoking cessation program, weight loss program. See what's available and take advantage of those. And of course, one of the best things that we can do at the work site is to participate in the National Walk at Lunch Day, or also the Step Out and Walk to Fight Diabetes, because you're practicing a healthy habit, but also supporting a great cause.
Marion Hay from Independence Blue Cross, thanks for being here today.
You're welcome. Thank you.
We'll be right back with more of The 10 Show.